Hey everybody, welcome to week 4. And you're almost done. We are almost done. You have just a few more assignments to go. You've done really well so far. Just have to stay focused a little bit longer on policy, marketing, and advocacy. So let's start with a little bit of housekeeping first. A little bit of review. I sent you out a announcement this morning about the exam average from exam number 2, as well as discussion board. I'm pretty positive students are working on getting that peer response post or those peer response posts updated and resubmitted. So thank you for that. I appreciate that. My goal is to get you those points. I don't want to just, cut you out of those. And I know, accessing the rubric and stuff is an additional step. And I know sometimes, you might have gotten confused about that. So I'm happy to accept those. I believe I closed that discussion board extension for those peer response posts. It's available until tomorrow at midnight. So that's Tuesday the 30th at midnight. So please do your best to get those peer response posts revised and submitted by then. Otherwise, discussion boards were wonderful. They were great. I really enjoyed reading your commentary, your detailed reviews, and thought they were excellent. For the quiz, I think I did message you about, or put in the announcement, about some of the bigger things that I'm seeing. I know everybody is short on time, but I do really want to encourage you to spend a little bit more time in the PowerPoints, spend a little bit more time in the text, especially right before you take the exam. Get yourself organized. Understand where the sections of the text are. Where's the epidemiology? Okay, where are some of the case study examples? And by epidemiology, I mean, what are some of the statistics that go along with the issue? So not what is the issue, who does the issue affect, and at what rate does it affect those people? Okay, so those are really important. Another thing I wanted to point out, when I say statistics versus disparities, okay, disparities can include statistics. Disparities are differences among groups of people. Statistics are numbers, okay? You can say more or less, some groups were more affected, some groups were less affected. Those in the Midwest smoke more. But when statistics are specified, that means, yes, you can say that statement, but you need to include a numerical description, which is a statistic. Okay. So I just want to make that really clear. And epidemiology is really important to understand. So your text does a really good job at the beginning of every chapter describing who is affected with, and in that description includes a very great variety of statistics. Okay. And you may be thinking, why do we talk about statistics in public health? Well, it helps us describe our population. Demographics are descriptors of a population. So they could be based in ethnicity, they could be based in race, they could be based in geographical region or location, zip code, neighborhood. They could be gender specific or gender non-specific. They could do with age, ranges of age, marital status, parent, no parent. How many children do you have? How many do you not have? How many days do you participate in physical activity, or how many days do you not participate in physical activity? Anything numerical like that is definitely, equals some type of statistical description. Okay. So I just wanted to put a little bit more behind that, because I did see some responses for the exam when it was required to include a statistic, there were no statistics. And I just try to be really fair with that and point that out, that there does need to be some type of numerical statistic in that response. Okay, I wasn't trying to be mean or anything like that. It's just exactly that is what it needs. I also noticed that I wanted to point out in the short answer responses, the short answer responses are going to come directly from the text. Okay, so for this next exam, please only take out your information for the short answer exam from the text. Okay, don't try and go to any of those supplemental resources, because the response will not be in the supplemental resources. Okay, it's going to be in the text. And it's not, internet. So just keep that in mind. Okay. All right. So I'll be grading your week 3 assignments. Sometimes they will definitely take me till the end of the week, probably because of the recordings, and I do listen to them. I don't not listen to them for the grading. So it does take me a little bit longer sometimes. So just keep that in mind. I'll get those to you as soon as I can. I will grade the discussion board first, so you can have that feedback before this week's discussion board. Okay. For this week, and of course, if you have any questions about grading or feedback, anything like that, please shoot me an email. I am more than happy to explain anything or discuss with you. So just let me know. Okay. This week we focus on some similar course learning outcomes as the last few weeks. This week you're a little bit more focused on the interdependence. You're looking at a different chapter that has to do with education and advocacy campaigns, which runs really deep in our country. And at the same time, there's some of the hardest policies to revise, implement, or create. So, I think there are, everybody comes from so many different walks of life. Human behavior is not a rigid line. It's variable. And so oftentimes trying to put together like a one size fits all policy for education, or, quote, better living, or improved, improved monetary outcomes or financial outcomes for the public. Those are very difficult. And so you'll see some of that in chapter 5 this week. So a lot of the interconnections and how social issues and health issues are very intertwined in one another. Okay. Sometimes we just can't, there's no waving a magic wand to try and fix those. So you'll see those exemplified this week. For your lecture, I just touched on it briefly, but you're down to 2 chapters this week. So we'll talk about your exam. I'll remind you about your exam again briefly in a moment here. But chapter 5 is the policy implications of social determinants of health. And so trying to improve social determinants, so like how one another is raised or how one another is brought up, what they were exposed to. That could be physical, social, or emotional. So there's a lot of factors playing into these social determinants. It's also, that physical location, the geographical location. Oftentimes that writes a lot of our script, right? So when they say you're born into it, there is some type of truth to that. Policies, there have been a variety of policies that try and make that better or improve it from that policy standpoint. Some people don't want to make it better, doesn't think it needs to be fixed, right? And some do. So it's a very touchy subject in policy. So you'll see some of those issues discussed in chapter 5. Chapter 11 is much more straightforward. I think when you see some of these policies, this is what you may have simply thought of in terms of public health and safety um, from, maybe when you were really small. Like I remember when I was younger, um, my parents being into like the consumer reports for, toddler products or things like that, because I had a couple younger brothers and sisters. Um, so things like magnets or batteries, the width of, baby walkers, for instance, like they shouldn't be so slim that they can fit through a door and that baby can get out of the room that you thought they were safe in. So laws like that, plus traffic laws, um, driving under the influence laws, everything like that is in this chapter. So it's definitely a um, very condensed chapter. There's a lot to go through in that chapter. It's not necessarily longer, but there's just a lot of different sample policies in that chapter. But very good and an important part. And I believe we do have one student that selected that topic. So thank you to that student, because sometimes this one goes unselected for whatever reason. Your supplemental reading is the same as last week because your exam, again, has been the same from last week to this week 3 and 4 exam. Okay. I will move the exam. I might have already, I need to move it from week 3. I'll move it down here to week 4, so it'll be in here for you. Here's the instructions again. So you do have one more chapter, okay, in this exam than I think what you're used to. So just be aware of that. It is the same format. And so you do need to spend some time reviewing these chapters in order to answer the multiple choice effectively. Okay, you just have got to. Whether you highlight some of the pages, turn down the page, dog ear the page, whatever it is, be a little bit vigilant about that so you can remember, oh yeah, I remember seeing that. I think it was in chapter 8, okay, because it has to do with physical activity, or I think it was in chapter 10 because it had to do with um, policies surrounding HIV, something like that. Okay. Um, so again, same resources. I'm not going to spend too much time on this because I went into really in-depth description of it at last week. So at last week's session. So if you need more dig in about, I did go through each of our resources here. So I went through the pink book. I went through the public health and media advocacy text, and I also went through the No Moss, No More study. Please check back into week 3, find my bullet point list and navigate to about that time period in the recording to find out more information. Pay attention to the page numbers here for the NCI Pink Book. The public health and media advocacy text, that question in the exam is going to be towards the end of this article. So you can read through examples of compelling visuals. You get to the application of the layers of strategy. The exam is going to focus on the evaluation of media advocacy. Like, how do we evaluate it? How do we tell that it's done what we wanted it to do? Okay. In the No Moss, No More papers here, I want to really point out that there are 2 research studies here. One is No Moss, the other is No More, and they are different. They're not a translation of one another. Okay, they have different framework, different methodology, different results, different findings. Okay, so just make sure you're really clear on that and read through it before you take the exam. Okay. And so this exam is currently open and it does close this next Sunday, the 5th at 11:59 p.m. Okay. Um, all right. So let's look at what's the interactive activity. I can't remember. Oh yeah. The week 4 quiz is good. I think you should do it. I think it will help you just to understand maybe how much you've learned and that things make a lot more, the concepts make a lot more sense to you now than they did when you first began. So I do encourage you to take that. Does it have, any specific exam questions in or anything like that? It does not. But I do think it's just good practice, good mindset. Okay. All right, so let's look at the discussion board. Okay, so week 4 discussion. This is the letter to your representative. This is available until Sunday the 5th, right? And the goal of this discussion is to draft, meaning write a letter to, doesn't have to be a local representative, it could be any legislator regarding a position on a piece of legislation. And actually, I need to change that because it's not a position. Okay, this is an advocacy letter, so I will change that out of there. You are writing an advocacy-based letter requesting requesting the policymaker to support a cause. Okay. So written communication is extremely important. We've talked about this. This form of communication, writing a letter itself, is even much better than filling out a pre-filled letter, like a take action. Okay, remember those, remember your take action, pre-filled letter or petition that you did last week. This is even better. Okay. So a grassroots advocacy group may encourage you to directly communicate with representatives to assure that your voice is heard, and that your stance on the issue or what you think needs to be examined more closely, that your thoughts are received by the policymakers. Okay. This is a draft letter, and so we're going to go through some of the requirements. Okay. First off, you need to visit the site to find a representative that you may be interested in writing your advocacy letter to. You're going to enter your address and your zip code, and it's going to give you the policymakers that are relevant to you. Because as you may or may not know, we have so many different types of districts, right? We have state, which is a type of district. And then we have, let me just get our situation up. Okay. So you have your state legislative districts, and that's different than the federal legislation. Okay. In most of our states at the federal level, based on the size of our population, we elect 2 senators, and then we have an assembly member that we have. Gosh, how many assembly districts do we have? I think we have close to 80 assembly districts here in California. Where I live, I am District 2, Mike Levin. Okay. He is California Assembly District 49. Okay. And then in our state legislation, we have a state senator and we have a state assembly member. Okay. They are districted. So the state, again, depends on, the state senator and the state assembly member depends on where you live. You don't necessarily get to pick your legislators, you pick them through voting for them. So this is why voting is important. This is why reading the blurbs or learning about who you're voting for, both for federal and state legislation, is important. If you are really feeling very close about or closely tied to an issue, and you don't research your state or federal legislator, and then you realize once they're already elected because you didn't really care and maybe you didn't even elect them. Then you find out they have a completely different stance on an issue that's really important to you, then that might leave a sour taste in your mouth because now someone's in office that doesn't really, follow your same trajectory and your same beliefs and thoughts. Okay. So that's why it is important to vote and to get involved. So for my letter, if I wanted to write about a state issue, like for instance, this is kind of near and dear to my heart, but we just in California instituted legislation in support of reimbursement for doula care. Okay, that's a huge step. We're one of the very few states that reimburses doulas for their care. And we're going to see improvements in health outcomes, especially in our disproportionately affected groups due to this legislation. But let's say you wanted to thank our state senator, Catherine Blakespear. You wanted to congratulate her on supporting this issue. And actually, I don't know if she really supported the issue or not, but I should look. Or let's say she didn't support the issue. It's not about the legislation, the bill number. It's about the issue. Okay. So you don't want to name anything by the law or the bill number because that's lobbying. You want to just say, thank you for supporting the issue of doula reimbursement for Medi-Cal enrollees. We're so grateful for your support. Da, 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 da. Okay. That's a state issue. Federal issue, you might want to write Senator Padilla about trying to think of something that's a federal issue. About the recent block by the FDA for regarding menthol cigarettes. It did not pass all the way through. It's kind of stymied right now. And the legislation was going to put a federal ban on menthol cigarettes. And now the FDA is stepping in saying this may not happen, and yada, yada. So you might want to write Senator Padilla about supporting the issue of banning menthol cigarettes federally or at the federal level. Okay, so that would be the issue, not the name of the law or the bill number. Okay. So once you say the name of the law or the bill number, it becomes lobbying. Okay, so how are you going to format your letter? Number one, you're going to include the representative's name and legislative title, okay, just like this in this introductory block right here, okay, Honorable John Doe. Is he a senator, U.S. Senate, or is he congressman, and what district does he represent, or she? Their address, and so you can find that if you click on Alex Padilla. You can actually find his contact info, his phone number, his office, and then he also has, different offices all throughout the state. Okay. All right. So you can find their office addresses there. All right. If you're wondering where that came from. Next, below this, in a similar format, you will include your local address, email address. It can be fictional. It doesn't have to be, true because we don't need to know your address, but you can just make it up. 123 ABC Street, something like that. Next, you're going to include the body of the letter. So you want an introduction. Okay. The introduction should be about 1 paragraph. It includes information about your personal experience, education, interests, and needs to include a statement of constituency. Okay. Also, it introduces the issue you want to address in 1 sentence. Okay. Constituency means you're just telling that policymaker that you do live in the area that he or she presides over. Okay. So in other words, a district that is representative of a specific legislator. So for example, when I wrote this, I still live in Carlsbad, which is still the 49th congressional district, but at that time it was represented by Congressman Darrell Issa. Okay. Right now it's represented by someone different. It's represented by Congressman Levin, but you just need to make that connection, because if the policymaker or their staff reads your letter and you don't reside in the area that they're responsible for, what you say in your letter is not going to be as important to them because you don't live in the area they represent. That is super important. Excuse me. All right. Next, you want to include your advocacy appeal. This is about 2 paragraphs. This is more your meat and potatoes. This is a statement on behalf of a community asking for the issue to be addressed, thanking or expressing disappointment and/or concern for recent support of an issue or non-support. It includes education about the issue and it's backed up by fact. And remember, again, your appeal should include a proposed solution, not a bill or name of a policy that you think will address the problem. Okay. Do not lobby. I say it again, a lot of different ways. The topic of the issue should be discussed. Do not include a bill number or legislation name because that's lobbying. Okay. So for instance, when you want to say something like, I do not support gun violence legislation. Okay. That's fine. You just don't want to say something like, I don't support Senate Bill 2-5 because and that's the the current gun legislation in California because of XYZ. You don't want to say that because that's lobbying. Okay. Just talk about the surrounding issue. There is an advocacy sample letter in your text. It's on page 335. The paragraph in the beginning, right before that example begins with, there are many ways to advocate on behalf of a public health issue. It is right about okay, so it's on page 335, right at the top of the page. Okay. The subject is soda machines don't belong in high schools. It's from somebody named Molly. It's to Congresswoman Sweeten. It says, Dear Congresswoman Sweeten, my high school has 6 vending machines filled with soda, sports drinks, and sweetened teas. I see students drinking these beverages every day in my school. I do not think that school should be selling these drinks to students. I learned in health class that these beverages are the largest single source of added sugar in children's diets and have been linked to increases in obesity and type 2 diabetes. I also learned that some beverage companies pay schools to sell only their brands. I think this is wrong. Why is my school taking money from companies to sell soda when we were taught in class that soda is not healthy? I think this is a big problem. Okay. So does she mention anything about the complementary foods legislation number or any, the name of the Healthy Hunger Free Kids Act? No, she doesn't. She just talks about the issue itself. That's a really good example. Okay. Then you're going to close your letter, say thank you, of course, and then you're going to respond to 2 peer posts. I give you some supportive ideas in terms of what can help you shape your conversation with your colleagues. And so those are just meant to be helpful for you. I do have resources here. Okay. Remember, your primary discussion board responses are due Friday. That's the other thing I wanted to talk to you about. I have seen countless posts that are posted on Sunday. And that's bringing a grade, it's bringing your grade down, pretty much a point for not posting on Friday. So I really encourage you, you can post before Friday. Maybe Friday is a bad day for you. Post before Friday. because you need to have, the class needs to have material available to them for their peer response posts on Sunday. Okay. Can't really keep falling behind on that. Please, I just encourage you to get that done. All right. I have other sample letters, but I'm going to show you the student sample first. Okay. All right, let me blow it up a little bit for you. All right. So as you can see, here are the addressee and the sender's information. Okay. And then we address the congressman as he should be addressed. Dear Congressman Ben Hueso. Okay. My name is, you don't need to include your name. You can just kind of blank it out. That's fine. My first name, my last name. You don't have to be very specific. You can use initials if you want. I live in National City, which is the 40th Congressional District in California. There's the statement of constituency. I am interested in respiratory health and air quality in our district. From working in the medical field near National City, I know there are many cases of asthma and chronic obstructive pulmonary disease. This could be from a mixture of people driving in the city or the lack of enforcement of emission standards. According to 2005 and 6 fiscal year data, overall asthma hospitalization rates for the South region are higher than countywide rates. Children under the age of 17 in National City have higher rates of asthma symptoms than the rest of San Diego. Child asthma hospitalization rates for National City are around 57% higher than the county average. Wow, that's a lot. That's an important issue. And then look at the citation right here. Okay, citations, yes, you need to include citations. And it's embedded right here in the paragraph, which is perfect. Many industrial businesses located near single-family homes had to relocate, but not all of them were forced to leave. In 2012, National City listed more than 100 businesses that were violating zoning rules and were forced to clean up or relocate. Regulations on air quality need to be stricter, and stronger representation needs to be addressed to the Air Pollution Control District Board. Education needs to be provided to people on how to improve air quality in and outside of the home, ensuring basic things like mandating a carbon monoxide detector and changing air conditioning filters can improve the air quality at home. It is important that residents feel safe where they live. It's also important to ensure the public is aware of the efforts being made to help their community reduce air pollution and to lower future respiratory and medical conditions. Okay. And then the references are down below. Okay, which is great. Perfect. Okay, so first we see our introductory paragraph. Okay, who you are, your statement of constituency, what the issue is. Okay, health and air quality, respiratory health. And then we have our advocacy appeal, right? The two paragraphs that include factual information, which we're getting we're getting used to. This factual information should be statistics. Okay. It should have some background, some education about the issue. Okay. And it should suggest a proposed solution, but not a legislation name or bill number. Okay. All right. So that is your week 4 discussion board. Most students do really well on that. And after often, I encourage students to send those letters in because some of them are just really great and they should be sent in to get attention from that policymaker. Okay. All right. You can also look, I forgot to mention, APHA has some sample letters. They are here as well. They always advocate as a grassroots organization. Let's see. Just seeing if they are. Most of these are suitable advocacy letters. This one in support of Preventing Maternal Deaths Reauthorization Act. That has a name of legislation, so that one's not a good example to review. Okay. And I give you, I also show you a good example right here. Okay. Also, the American Lung Association has some sample letters as well. One good example, some of them are more lobbying based because they mention bill numbers and names of legislation. This one's just about improving fuel economy standards for different model years of cars. And so this is another good example. It's long, it has a lot more background facts and information in it, which is fine. And it's an organizational sign-on letter because as you can see, we have several institutions listed here. Okay. But nonetheless, another good example. All right, so let's look at your signature assignment. Okay. I want to emphasize this is an APA paper, which just means, it's double spaced. It has 1-inch margins. It has a title page. It has a running head up in the top, okay, at the top of the page. It does not have an abstract. Okay, this is not an experimental paper, so it doesn't need an abstract. Okay, so please do not waste time including an abstract. All right. So different resources for you. Okay. This assignment does use Turnitin to evaluate for plagiarism. So I talked a little bit about this in office hours last week. It will run your paper for a match or for matches, 2 sources used. So if I see your paper and it looks like a lot of your paper is like 85% match to the source, 90% match to the source, I may contact you to have you rewrite your paper, resubmit it for credit. And if you decide to, you don't want to do that, I typically give students a choice. If you decide you don't want to do that, then you will receive, I will be subtracting points from your paper for that plagiarism. Okay. So use a thesaurus. There's several online thesauruses that you can utilize. And a thesaurus is full of synonyms, which synonyms give you words that mean very much the same to the word you want to use. By replacing words with synonyms, you would be amazed at how much you can reduce your similarity report. Okay, so just a thought. Turn on your thesaurus and just replace a few words in your sentence. If you're having a hard time summarizing in your own words, use the thesaurus to give you a different idea of some of these words. Okay. All right, so you have your description outline and sources. You have 2 sample papers. You have your professional gateway, the public health law website, which I'm not sure if you really truthfully need that after reviewing the paper or the outline, sorry, but you may still utilize it. Okay. All right, so let's look at the paper. Okay, there's a couple different parts. It is a 5-page paper. That does not include, that includes the body of the paper only, 5 pages. The title page, references, anything like that, those are not included in that 5-page count, okay? You need to identify a United States legislation that has had significant impact on the burden and distribution of disease, injury, excuse me, and affects or has affected health disparities. I really only encourage you to look at policies that have been in effect for more than 4 years. And the reason is because that gives time for that data to be analyzed. It gives it time to be evaluated. And if you don't have that time, you're not going to find what you need for this paper. Okay. So we're 2024. Really, all your policy you're looking at should be older than 2020. Okay, that's very, 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 very important. This legislation could impact behavior, social determinants of health, or the environment in which people live, play, or work. Your text is a wealth of all this information. I would encourage you to go to your text, and we'll look at that in a minute, where you can pull out some of these exemplary policies. Okay. So you want to think about how significant the legislation is in terms of its impact. Okay. So the broader or deeper the impact on a population or a health issue, the more significant it is. So legislation that has resulted in setting blood alcohol concentration limits, these legal limits, it has very positively impacted health outcomes and at the same time decreased economic costs. And we've seen big decreases and improvements in health outcomes. Okay. I don't recommend that you select legislation that's disjointed or doesn't have a large amount of readily available information. If you notice when you're searching that you keep running into a dead end, that should be a hint for you to change your topic, change your legislation. Now, I know some of you get very, tied into your legislation and, really want to do it on that specific topic, but you don't want to make it so hard on yourself that you can't complete it, or it's just so difficult, you get really frustrated. Okay. All right. Just move on to a new topic. It's important to define impact. Okay. What does that mean? It means it has a strong effect, or the issue or the policy has a strong effect on someone or something. We measure impact in policy as what do health outcomes look like before and what do health outcomes look like after the policy was enacted. This tells us the impact of the policy on the population. Okay. So you have different components that need to be addressed and included. And the first one you need to look at is describing the health problem that the legislation was intended to impact. And in this, you need to provide descriptive statistics. So incidence, prevalence, those statistics, right? Percentages is prevalence. If you see something like rate of death, incidence rate, those are all statistics as well. You can include those also. Importantly, about the statistics, okay? If it is a state policy, if it's a California policy, okay, the statistics you include about that problem or that issue should be relative to Californians that are affected. It should not be those that are in Florida or in Montana or different states. Okay. So hopefully that makes sense to you. They should be connected. Next, you will describe the legislation itself, the law, the policy, or the ordinance, depending on what level of government it was enacted in. It needs to be thorough. Tell me, is this a federal legislation, a state legislation? Is this local? Is this a city ordinance? An ordinance is a city legislation. Okay. State and federal have laws as well. Remember, if it says, it's affecting, though that policy has affected a certain state, that's probably means it's a state policy. If it says something like, when you're reading about it, this is a federal legislation, this legislation affects the entire nation, those are all hints that this is a federal legislation that you're dealing with. Okay. So describe that legislation and the level of government. Then describe what group or groups or communities in municipalities, states, or governments that it's hoping to impact. What is the goal of this legislation overall? Okay. Why was it implemented? What's the goal? Next, the impact of the policy. Okay. So you want to compare the burden and distribution of the disease across age groups, ethnicities, socioeconomic status, gender. Okay. Using stats that clearly illustrate the impact before and after that legislation. Okay. So how have these numbers changed? Okay. Before the legislation, after the legislation, all right? Did the legislation affect only young adults versus young adults, adults, and the elderly population? Did you see a difference? Okay. You want to really highlight the differences here when you're talking about the impact of the policy. Okay. Number one is on the burden and distribution of disease. How did it change across groups? Did we see rates change of driving under the influence in only 17 to 21-year-olds, or do we see it affect the entire age spectrum? Okay. Or only in one state or across several states? Okay. Next, identify and describe health disparities among populations. Okay. Health disparities, remember, is differences across groups that exist before the policy was enacted and after it was enacted. Did the implementation have a positive or negative impact? Okay. Health disparities among populations. So when we talk about differences among groups, if this was a federal blood alcohol concentration legislation, did we see that those in low-income communities had remarkably improved health outcomes and less injuries due to the implementation of this law? Did we see the West Coast do better than the East Coast? Did we see certain ethnic populations improve their health, lessen their rates of injury due to this legislation? Okay. So you're looking at differences among groups for Section B. Okay. Next and last, explain the financial impact. Okay. We talked a little bit about economics, policy and economics last week. We see it again here. It is intertwined in health policy. So explain the financial impact the legislation has had. Okay. Include research that shows the burden of cost before the legislation was enacted. Okay. And show the difference or make a comparison on the cost savings after the law was adopted. Most of the time, it's going to be cost savings because of the law. Oftentimes, healthcare costs will be reduced because of the law. And because of the law, most of the time, you will see increased productivity or reduced absenteeism, okay, because the population is healthier, right? So they're sick less, they're absent less, they're working harder, they're working more. Okay, that's the increased productivity part, all right? And so that is the last piece to include, that financial impact. So the cool thing about this is that your text goes over each of these impacts for the most part across almost every chapter and in at least one case study. Okay. You want to make sure that you're integrating course concepts in your analysis. Okay. What is not included in this write-up right here, which I need, it's down lower in the outline, is you need to include a blurb about what advocacy was done in support of this policy. And I will add that into this sample here. It's in the rubric and it's in the outline below, but it needs to be up here. So what advocacy was completed in support of this issue that you select, or this policy, excuse me. Then what is your conclusion? Okay. When you're comparing impacts, think about what it did impact to what degree, what factors might have played a role. What's your take on it? Do you think more policy needs to be implemented? Do you think it's a weak policy? What's your 5 cents? Excuse me, what's your 10 cents? I'm telling you, 5 cents. Okay, again, 12-point font, Times New Roman or Arial, 1-inch margins, double spaced. Okay, no abstract. All right, next I go into your research resources and your outline, okay? So your text, Prevention Policy and Public Health, has a wealth of resources on specific policies you can use. You can also use peer-reviewed journal articles, data analysis from public health departments, state, national, local levels. Any of that is acceptable. You can use, from the National Library, EBSCO host, CINHAL, you can use all of those. If you need to reach out to the writing center, I would make sure you schedule an appointment earlier rather than later. Maybe get it scheduled as soon as you can, so they can help you formulate your paper. So how do I write this paper? See below here, what are good policies versus those are not, sources that can assist you in locating a topic, and a sample outline of the paper. Okay. All right, so good public health policy issues. Federal, state, or local, all right? So increasing safe workplace practices. I talked about blood alcohol concentrations, excellent topic. Alcohol taxation, minimum drinking age, drunk driving checkpoints, speed limits, tobacco. Speed limits is pretty good. It's a little disjointed across states, but pretty good overall. Definitely impacts, positive impacts. Tobacco, you could focus on several things: taxation, secondhand smoke, minimum smoking age, marketing and packaging. There's, some great examples in your text for tobacco as well. Great examples in your text for blood alcohol concentration and speed limits. Immunization is a topic you could do, but I would really highly encourage you to focus on much older policy. Like the policy of, I think it was 79 or 80, it was the School Vaccination Act, I believe, or the School Immunization Act. That was when there was a really huge push for ensuring that all children are vaccinated. Before that, there wasn't a lot of vaccination policy in schools. So you see big improvements, big reportable outcomes. Some of the newer vaccination policies, like from, the early 2000s, mid, 2010, things like that, 2008 with the measles outbreak. Those numbers are so small, they're insignificant, and they're really going to be hard for you to report on impact. Okay. School lunch policy, nutritional standards. Don't focus on obesity rates, okay? Focus on the changes in reimbursement rates for school, changes on how many school districts were able to implement these standards versus before the policy, things like that, because unfortunately, it hasn't done anything for obesity rates. So that's kind of a bummer. Infectious disease, healthcare associated infections, things like MRSA, HIV. Seatbelt laws is another good one. Emergency preparedness laws, needle exchange programs, that's an excellent example. Prescription drug laws, the Affordable Care Act, family planning, like long-acting reversible contraceptives legislation. And then don't forget about laws funding for specific health programs. So things like the condom prevention program, that's a really good one. Any legislation that allows a public health program to be funded is still a law. And they do have to report back about how effective that law is, and it will continue to be funded. So that's a good topic. I encourage you to shy away from helmet policy, violence prevention policy, and illicit drug use policies like decriminalization. Medical marijuana laws are just too early to determine the impact. And they just haven't had a collective review yet. I would expect that in the next few years, but not yet. I have several CDC policy impact briefs, okay? You want to review this to help you select a topic, review the EPI about the issue, review the impact statements, assist you in guiding your research. So let me see. Which one? I need to update a few of these, I think. So drug overdose, all right. So um, prescription drug monitoring programs and pain clinics. So really good topic. We've seen several state successes. And when you scroll down to the bottom of this page, it will give you the references here, okay? So you would go to these sources in order to find more information. Like for instance, when you see the number 2 here, that means that this is MLA, not APA. But number 2 means it came from this source, mandating PDMP participation by medical providers. That means all the information is in this resource. But look at all these states that have had such benefits from pain clinic and opioid prescription drug monitoring program implementations. So Ohio and Kentucky, they mandated clinicians to review PDMP data and implemented pain clinic regulation. And they found that their per capita usage decreased in 85 and 62% of the counties. Like, are you serious? That is such a huge increase. It's insane. I mean, that's not 20%, 85%. I mean, that's astronomical. Very successful policy. In Florida, where multiple interventions targeted excessive opioid prescribing from 2010 to 2012, amounts of opioids prescribed decreased in 80% of the counties in 5 years. Florida also experienced reductions in opioid-related overdose deaths. Okay. So here's the 2010 action. The regulation of pain clinics, that's a law. The result, 50% decrease in oxycodone overdose deaths. I mean, that's crazy astronomical results. So as you can see this right here, here's the year. Oxycodone prescriptions fell by 24%. Deaths fell by 52% after years of increases. So as we can see, deaths keep increasing. They peak at 8 deaths per 100,000 population. That's a rate, okay? And then what do we see here? Okay. We see the prescriptions decrease and the death rate starts to fall, okay? So this is when they implemented the law, 2010, okay? And we see this astronomical decrease in number of prescriptions and the number of deaths, okay? All in 2 years, right? So that's huge. So that's a great topic to write about, okay? There's graduated teen license driving as well. That's an interesting topic also. I'll update some of these links. I think alcohol pricing needs to be updated, clean needle exchange, and I'll make sure those are updated for you. But I would go there if you don't like the topics in the text. Here's your suggested outline for the paper, your intro, your legislation, your discussion about the impact on disease, impact on disparities, economic impact. And then here I mention again, advocacy about the issue, okay? So make sure you get that piece in about advocating about the issue. Is there an organization that supports or supported this policy? Is there a health campaign about this program? Describe it, okay? So I really hope you utilize this paper outline. Truly, your paper, I would just copy and paste this into your, your document, and I would start building from there, okay? Tick off your list. Describe the health problem the legislation was designed to work for and improve. Provide a minimum of 5 descriptive stats, okay? And just keep going, keep going. I would use this. Don't just do it off the top of your head, because all this is exactly what I'm looking for, all right? Okay. So I talked for quite a while now. You can review the policy impact sample papers. The public health law website, I mean, it's good. I just think those links I give you are a little bit better. But these are, prescription drugs is in here, motor vehicle injuries, vaccination laws, emergency preparedness, zoonotic disease laws. So those are all pretty interesting. And just remember, if you don't find a lot of information about it, move on to a different policy. Okay. Maybe maybe tribal law is interesting to you. That's also something that could be done for this topic. Okay, so that is week 4. And that paper is due the 5th as well. Okay. All right. I think I went over everything. I will be in office hours tomorrow at 2 o'clock until 2:30. Hope to see you there if you have questions. Otherwise, shoot me an email. I'll do my best to get back to you as soon as possible. And it's been great. So let's make this last week excellent. If you had kind of struggling for the first couple weeks in the course, let's try and really make this a great week. Okay. All right. Thank you so much, everybody. Appreciate you. Appreciate your efforts. And I will talk to you this week. Hopefully I'll see you tomorrow. All right. Take care. Have a great night.